Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to Talking Head Pain, the podcast that confronts head pain head on. I'm your host, Joe Koh, Director of Therapeutic Area Growth and Integration with the Global Healthy Living Foundation, as well as President of GHLF Canada. For today's special episode, I'm at the American Headache Society. I'm turning to a very special guest. Can you tell me your name and share what you find most impactful at the American Headache Society?
So I'm Dr. Eyal Maoz Halevy. So the most exciting thing is that I get to meet professionals from different areas from the country, from the US in headache. And I'm surprised to learn how much they differ and they have different interests in the field of headache that, of course, they all complement each other. And just yesterday, I was in a very fascinating lecture about LGBTQ medicine. And there was a doctor there who talked about the interactions between medications for headache and for gender reassignment, things we should all be really aware of. So that's just, for instance, something I learned. So yeah, for me, it's a learning experience and meeting the right people.
I love that so much. That's an important topic that we've covered on Talking Head Pain. I want to turn to a recent award that you got just the other day here at AHS, the Frontiers Award for your research on physical activity as a vital sign in migraine. Can you talk a little bit more about that?
Physical activity as a vital sign, PAVS, is actually already in use in some medical fields to assess the amount of physical activity done by patients with chronic diseases, such as arthritis, for instance, and patients with schizophrenia, for instance. Because we know the amount of physical activity patients with migraine do affects the disease. We wanted to look into what amount of physical activity patients with migraine do, because we know it's never been quantified. And we wanted to see if we can actually utilize this PAVS also in the field of migraine. So we took a prospective cohort of patients with chronic migraine or episodic migraine, and we took their PAVS score, which is made up of the amount of days a week that they do any amount of physical activity and how many minutes each day. So you multiply the days by the amount of minutes each day to see if they do enough physical activity that meets the recommended guidelines, which is 150 minutes a week. And we saw how patients with chronic migraine do physical activity, but less than patients with episodic migraine. However, the surprising fact that we saw is that patients who have migraine overall, whether chronic or non-chronic, on average do more physical activity than amongst the average general population in the United States, which means that patients with migraine are aware of the fact that they need to do physical activity as part of balancing their migraine headaches.
It's so interesting, and that's a topic that I find personally interesting as someone who just became a personal trainer and nutrition coach who lives with migraine. So really excited. I'll check out this research. Physical activity is a vital sign. Really interesting. Thank you so much for your time and for joining me on Talking Head Pain.
Thank you very much for having me.
Thank you for listening to this special episode of Talking Head Pain, the podcast that confronts head pain head on. If you have any questions, thoughts, or suggestions, you can send us an email at podcast@ghlf.org. If you enjoyed this episode, please leave it an honest 5-star rating, write a positive review, and spread the word by sharing it with your friends and family. I'm Joe Koh at the American Headache Society, and I'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.